Hey guys, your favorite girl and your favorite podcast, The Bliss Hour, and I welcome you all specially to another episode which is tagged Anonymous Questions with The Bliss Hour. You know how we do it. We have guests who comes to the studio to give you professional answers to your question. So for those of you who has asked a question and also want answers to your question, sit tight, do not go anywhere. We'll be right back. Welcome back from that short break, guys. Like I said, we have professional guests in the studio with us today. We have a beautiful, a gorgeous one at that, and a handsome guest in the studio with us. They are two professional doctors. Please do us the honor of introducing yourself from the man, please.
Hi, good to be here. My name is Prince Heaven Knows, and I'm a final year medical student.
Okay.
Okay, good afternoon, everyone. My name is Dr. Ezekiel Courage Chukwuminia, and I just graduated from River State University.
Okay, so apart from medicine, being a doctor, what else do you want us to know about you?
Okay, from me?
Yes.
Well, okay. I enjoy a lot of things during my leisure time. Actually, I enjoy cooking
Okay.
and baking, and then I'm actually very good at planning a lot of events.
Okay.
And I'm into public speaking also.
Okay.
I have this interest in learning certain things online, like there's this thing called KDP. It's on
Okay.
site on my free time also.
Okay, you do a lot of things, I must say.
Actually.
What about you?
Well, I'll say I have a career in medical journalism. And
Okay.
I tend to come on air, radio programs, and I've been a guest on a few shows, and I try to push the medical dream. Yeah.
This is just your thing. All right, you're welcome once again to the
Right.
Bliss Hour.
Thank you.
So, for the first question on our anonymous question list is from a Gen Z, a 19 years old girl. She says she has sex once with her boyfriend. So, do you think she can be pregnant with just one sexual intercourse? Because she hears people saying it.
Okay, I should go ahead
Yes.
and answer that. Okay, to answer her question, yes, it's possible that she can be pregnant
Okay.
from just one sexual intercourse. That's possible because in order for a girl to get pregnant, what happens is that there's the whole cycle thing, and then once every month, her one of her ovaries releases an egg,
Okay.
and then if she should have sexual intercourse during that period between before the egg is being released or when the egg is being released, or even if it's just few hours or some days after the egg is being released, and then the sperm that has been released into her from the man is still viable, it's very possible for her to get pregnant.
So,
Actually.
what about the withdrawal method?
Okay, actually, if the man is, how will I put it now, is efficient enough to withdraw
Okay.
before he releases inside of her, then there's no way she can get pregnant. Like I said, in order for a pregnancy to actually occur, there needs to be a meeting between the ovum or the egg that is released from the female and then the sperm from the male. So there needs to be a meeting between them. And then whenever the ovary is being the egg, sorry, or the ovum is being released from the ovaries, it stays at a particular point in the what they call the fallopian tube for a while, and then after a few days, it becomes it becomes achetic. That's the word that is being used, and then it's no longer viable. So within this period of time, when the egg is there, that's called the ovulation period.
Okay.
When the egg is there, if any sperm should get into her body within that period of time, it is very possible for her to get pregnant. But if sexual intercourse should occur outside that period of time, then the chances of her getting pregnant are actually very low, and I don't know, near impossible actually. But withdrawal method, well, like I said, if the guy can actually withdraw efficiently without any sperm being released into her during that period, then there's no chance of her getting pregnant. But the chances of getting pregnant, even though it is your first time, even though if it is the first intercourse, is still very possible.
Okay. What
Yes.
about you? Do you think so?
Well, I think yeah, she said a lot, and I think she can get pregnant
Just once.
just once, of course.
All right. So another one is from a 20 years old. She says she feels tired after sleeping for 8 hours. Is it normal or there's something wrong?
8 hours. Depends on when she starts the sleeping cycle, right?
Okay.
So it's like a 3 hour cycle. You start, you do REM and then NREM sleep. So if she starts sleeping from 7 and then she sleeps till 5 or 6, there's a thing that happens in the circadian rhythm where it depends on how you sleep. And should I say, science has proven to us that if you sleep and we time ourselves. You sleep, you wake up, you sleep again, you sleep. Depends on when you want to get active. So if you start getting
Okay.
active from 7, you should, wake up probably 6, 5. Depends. So you have an energy, you have the energy to do your work. But if that your 8 hours was like from seven to like 3, you do a few activities. You want to get active by 7 a.m.
Okay.
You still fit that because you've not had a fresh sleep before your activity. So
Okay.
your sleep should be closer to your activity.
Okay. So it's from the way you sleep.
Yeah, your
Okay.
timing of the sleep.
Okay. What about you?
Okay, the question and another way you can look at it is she's looking at the quantity of sleep, let me put it that way, the duration of how long she slept.
Yes.
She can also look at the quality of sleep she's having. For example, I can be on my bed for over 10 hours. I'm actually sleeping, oh, but then he said something about REM and REM sleep.
Okay.
So I can be there for 10 hours actually, and I'm sleeping, but I'm conscious of what is happening around me. I can hear the voices around me. I'm just conscious of what is happening around me. It actually means that I'm not in deep sleep. So it's about the quality of sleep. There are persons that even sleep for shorter than 8 hours and they
Okay.
wake up feeling refreshed.
Yes.
So my will I say advice to her would be to work on the quality of sleep. There are
Okay.
different things you can do to make yourself more comfortable. You can change your beddings, make them neater, make your environment more clean, and make sure the environment is quiet while you're sleeping if you're somebody that cannot tolerate noise. And then another thing that she can do, if this is a constant problem that she has noticed, is that she can adopt what we call sleep hygiene, whereby you time yourself, like he was saying, the time you sleep. Like I can make my sleeping time every day 9 p.m. and then wake up at a certain time. If you're he talked about circadian reading. So if your body can adjust to, okay, this is my sleep and wake time before I start my activities in a day, it will actually help her sleeping pattern.
Okay. So you both mentioned something REMs, big words like that. So can you break it down for our audience?
Okay. I think one of them is there's what we call the REM sleep. One there's rapid eye movement, and
Okay.
then the other one is the deep sleep. I can The other name is
Yes,
RAM movement,
non-rapid.
non-rapid eye movement
Okay.
actually. So for the rapid eye movement, I think it's usually the first stage
Okay.
where the person is initiating sleep, like that first time when you just start sleeping, and then there's still this consciousness about what is happening around you. Like for
Okay.
example, if you're going to bed now, you might just be conscious about what is happening around you, but as time goes on you notice that you drift off, something as if you're losing consciousness. You're no
Yes.
longer aware of what is happening around you, so you have to transition to that phase. So if somebody is not able to transition to that stage of deep sleep and then you remain in the previous stage, that's when the quality of your sleep will be reduced. So
Okay.
that's the REM,
So
and
there's
then
nothing wrong. Just to work on her sleep.
yes, just to work on her the quality of her sleep
Okay.
better.
All right. So this is from me, 31 years old. She said, I lost my child, and since then, I'm scared of having another child due to the fear of losing the child again. So she feels like she also lost interest in sexual intimacy. So what can she do? She's married.
She lost her child.
Yes. Her
Let's
first
take
child.
it one by one.
Yes.
She lost her first child.
Yes.
It depends on. So we have to now take the history. Like
Okay.
what are the circumstances
Okay.
that aroused the how long was the pregnancy first of all?
Normal time.
Mm-hmm.
Normal months.
Like when did she lose it? When did she lose it?
Well,
When
she
did she have that
didn't say. She
miscarriage?
just said she
Exactly. So
lost the
so
child.
she will need professional advice, right? She will
Okay.
need to go to the hospital and then they'll talk to her about it to take a detailed history. Then you will
Okay.
need to find out a lot of things.
Okay.
Then if the pregnancy was close to term and she lost the baby, or no, if she lost the baby, that means it was a miscarriage and
Yes,
it wasn't it
miscarriage.
wasn't viable
Yeah.
before that time. So we will need to seek professional advice, right? And then we'll find out why it happened.
Okay.
Then we'll take the treatment that way. Then she says she's scared of
Losing the child
losing the
again.
child again. She shouldn't be scared.
Okay.
If there was something she did that made her lose the baby, with professional advice, she would know. We'll tell her about it, and then we will try to avoid that recurrence. But
Okay.
then just a miscarriage has different factors, different things causing it. So we shouldn't approach it with fear. We should approach it with knowledge.
Okay. So what about losing interest in sexual intimacy with her husband?
Well, losing interest is not related to her
Okay.
miscarriage,
It's
right?
related to something
It
else.
has to do with this high psychology about it. It could be that she is not so interested in sex, right? It could be that she's not so enjoying it that way.
Okay.
If they were enjoying sexual intercourse before that miscarriage,
Yes.
and afterwards she started noticing that, or it could be that she has a way she wants to do it, and they are not communicating well with that.
Okay.
So I think that she should see a therapist. They should talk it out first. Talk it out with her partner,
Okay.
and first, no, before talking out with her partner, she should understand herself. Why is she not wanting it more? Is there possibly a reason? Talk to a therapist. Then she have a conversation with her partner.
Okay.
Then they can both see a therapist, and
Okay.
they can find out why it happened that way.
Okay. What about you?
Okay. So just to reinforce the points that he has made. First of all, she said she lost a child.
Yes.
She's scared of conceiving and
Yeah.
having another one, and that's probably what is making her avoid
Sexual
sexual
intimacy.
intimacy with her husband. So, first of all, I want to say sorry to her for her loss,
Okay.
and then I think, like he said, it's more of a, will I call it a post-traumatic stress disorder kind of thing. So
Okay.
she has been traumatized by the previous events. I've even seen people that lose their dogs, an animal, and they are so, like, they are
Yeah,
devastated by
true.
it. So this is a child that she carried, she was attached to, and then now the child is no more. So you can imagine the kind of trauma that she must have been through. So it's actually a psychological thing.
Okay.
I'm very sure if she goes to the hospital and they probe further, they'll find that she has probably lost interest in doing other things that she actually had interest in. She's probably more, how would I put it now?
Private, indoors.
Yes, indoors than she used to be before. And so you start to see that these things are actually symptoms of depression actually. So she should, like he has said, seek professional help. That's the way forward. And then it would be very wonderful and nice if she has a supportive and understanding partner who should also join her when she goes to the hospital to seek
Okay.
help. But the way to go about this is to seek professional help, because from the line of symptoms from the story, it's very clear that she has just been traumatized by a previous event that she does not want to reoccur again. So she should seek professional help to, get over what happened before. That's in where you cannot move on because of the past, to get over the past so that she can move forward. That's what
Okay.
I think she should do.
All right. So the next one is from a guy. He said he feels pain when urinating and he's scared to open up, fear of people saying you have an infection and all that. So what should he do?
Feels pain while urinating.
Yes.
Uh, one thing about medical questions is that there's usually a story behind it,
Okay.
and that's why we like to find out what the history is.
Okay.
He could have the pain while urinating could be from an infection.
Okay.
He could have contracted it um, due to unclean environment where
Okay.
he's kind of using an unclean toilet, or it could be a sexually transmitted infection too.
Okay.
So it could be in this too, like, and probably he has poor hygiene too. So we would kind of like try to find out the history
Okay.
in his
He
case.
said he has had sex with his partner.
So he had sex with his partner, and then afterwards
It
he
started.
it started happening that way. So of course you shouldn't take it lightly. And these are, if pain is a symptom, or pain is a symptom where it tells you that there's something,
Okay.
there's something that might happen. So you should see a medical professional and say, okay, I have pain there, and then they'll start the treatment for sexually transmitted infection.
Okay.
First of all, do tests, find out what exactly
Okay.
it's, which type of infection it is. Then you go through the full dosage of treatment,
All
and
right.
then you'll be fine.
Okay. So what do you have to add?
Okay, to add to what he has said already, like, okay, let me take from something he said. He said the pain is just the symptom.
Yes.
So this guy said that what could this be, right?
Yes.
So first of all, like he said, you have to do a lot of exploration to find out what exactly is going on with him. So it could be many things. We cannot just say because you have pain during urination, it is this, it is an STI, it is just one thing. The
Yes.
problem might not even be from his lower urinary tract, like where he's going from. It can be coming right from his kidneys and he won't even know, and then probably there's a progression or something. So like you already said, he needs to go to the hospital and see a doctor. He said he's scared of opening up, right? I understand why you might be embarrassed or why you might feel shy about doing so. But then what the guy should be considering is the consequences of not actually opening up.
Okay.
Because a disease process, most of them usually leave some things behind, some, let me use the word, scarifications behind. And so
Okay.
you tend to see the consequences over years, not immediately. And then you not even know that, oh, is that thing that happened back then that has led to this. So he might leave it and it may
Okay.
resolve on its own. But it is important that in order to avoid future consequences that will be very bad, you should actually try and open up. There's nothing to be, how will I put it now? There's nothing to really be embarrassed about. There are a lot of persons that have come down with this situation. They just go, they get treated, and they are fine. And the beautiful thing about the medical profession is that you would not walk into any doctor's hospital and they'll be so concerned about what you've
Yes.
done, sorry, that got you to that point. Nobody's there to criticize you or
To
judge
judge
you.
you.
They just want to know what the issue is and how they can provide solutions. That's it.
Okay.
So there's really nothing to be scared in opening up about.
So it's just a chip in with his partner.
Okay.
You see,
With his
that's with his
partner.
partner.
All right. So the next is from a 19 years old. She said, I get body shamed a lot and I do not want to do something I will regret. Please, what's the safest way to lose weight? Start from you.
Well, let's start from what we commonly hear, right? Exercise,
Okay.
exercise, dieting. You should see a dietitian.
Okay.
Plan your meals. Know the amount of calories you take in every day. Know exactly what and understand your body
Okay.
and know that okay, you need to cut down on your calories.
Okay.
You need to eat more proteins, less of fats and carbohydrates.
But to be
So
honest with you, exercise is a lot. Let me
exercise is a
just
lot.
be
It does
honest
a
with
lot,
you.
right?
Yes, but then it's a lot when you want to start. Starting it is not easy.
It isn't. It isn't. And personally, I kind of take a few friends along.
Okay.
If I'm going for early morning jogging or early morning walking, I'll be like, oh, can we do this together? And then you have an accountability partner where you guys go for your exercise together.
Okay.
And it does a lot in the long run, rather than you saying yourself. Because I'll call you. I'm like, you don't feel like doing it that morning, but I have to push you.
The motivation.
Give you the motivation. So yes, and she shouldn't go into. We don't advise you go and start drinking. All these
Slim
slim
tea.
teas, and then I know there are some drugs now that people take.
Yes.
And they might sell a drug to you, but you don't know the constituents of that drug, right? The drugs have multiple effects, multi-systemic effects, right?
Okay.
So if you want to tackle it that way, it could be genetic, right? You could have a natural propensity towards gaining weight more than someone else. It could be that way. So you shouldn't see it as a problem. Take advantage of it. Glorify your body, accept it, go in a direction that puts it in a right path.
Okay.
Exercise, diet, see a dietitian, have an accountability partner. It could
Okay.
be fine.
All right.
Okay. So how I like to approach this is, first of all, I want to let her know that what is happening with her is very normal. I don't know if you can remember the lectures we had from, I think, home economics back then in secondary school, when they were telling us about the changes that a young girl and a young boy will undergo when they
Okay.
hit puberty. One of them is that your cravings for food actually increases, and all these things are happening because of the hormonal interplays that are going on in your body, the release of different hormones, and more especially for a woman who has a cycle every month. So it's normal. It is very normal for her to gain weight. But then she's saying that she wants to lose weight, and then what are the best ways to go about it? He has already mentioned one of them, which is exercise, dieting, and the rest. So one thing I'll like you said, it's difficult. One thing I'd like her to know is that consistency is key. And when they say consistency, it doesn't mean that if okay, I start exercising or working out today, or I start cutting down on my diet, and then 2 weeks later I go back to doing what I used to do before, and then I completely give up because I went back. It's very normal. It will be like that. There are days where you'll be like, oh, I'm on today. You know that we go again today. And you're
Yes.
like, I'm not going again
We'll go
today.
again tomorrow.
It's very normal. So consistency is key. You start today, you face a problem or you have a relapse, you continue. So like he said, diet is very, very important. And there's a lot with losing weight. I wish we had a lot of time to discuss losing weight very properly. Because there was one time I myself I was actually very into, oh my god, I really wanted to lose weight that time. And it did work out because I had a lot of time in my hands then. That was 2020 during the whole COVID break.
Okay.
And there were a lot of things I noticed. And for somebody that wants to lose weight, like he said, get an accountability partner. That's one. join groups of persons that are also doing the same thing that you're doing. It's very, very important because it helps you learn about new trends, new things that you should know. Like I said, when I started back then, I was so interested in cutting down on what I was eating, and I started feeling tired every day. And it was bad
Okay.
until I saw somewhere that I can, okay, for somebody that has been eating this much before, you can't just come immediately and reduce the
Yes.
size of your food and expect that there'll be magic. You start feeling tired actually. So there's a lot to do, like I'm saying. There's consistency. There's whenever if there's a relapse, just keep pushing, you keep
Okay.
going. So there's diet, there's exercise, there's getting people around you that are doing the same thing, getting an accountability partner that like he said. And there's really a lot to do. But then she should not do anything that she knows should not be done. Like you said,
Okay.
slim teas, drugs. There are actually surgeries too that help with this, but that's
Yes.
way extreme. But she should start with this first, and one way or the other, it will actually work out if she can be consistent.
Okay, so talking about dieting, you all know that it's quite expensive,
Okay.
especially for someone that is staying in her family house with her parents. You don't know the size of the pockets.
Okay.
So, what can you advise? Because it's what they provide, she's going to eat. So,
So I think you could start with rationing your meals and
okay,
looking at the intervals you eat. So if she's eating 4 times a day or binge eating,
okay,
cut all the binges. Don't eat without just eat at specific times, right?
okay,
So and you check the like that's why I talked about the daily calorie intake of the person. So if you discover a dietitian and they are recommending, okay, take this quantity of food, you know, okay, I should take, let me take two spoons
okay.
breakfast, 2 spoons. Or if you want to take bread, bread is like a very, very good source of gaining weight. Yeah, so you can eliminate bread.
Yeah, I love bread. What am I
Yeah,
going to
we all
do?
love bread. Yeah, but bread is like one of the number one sources of weight.
Okay,
And we can't help it. Cake, sweet things, things that they have fat, they have carbohydrates. We love them. So it's just not just about her family. The family food, bring it, divide it. Talk your dietitian. How many spoons should I take?
okay,
Start that way. You're not reducing the number of times you're eating. You're reducing the portions you're eating.
okay. All right. So, the next one is from a 23 years old. He says he masturbates and he heard it causes infertility. So, how true is this from you?
Okay. Um well, there is no research currently that I can see that can say points directly that there is a direct association between infertility
Okay,
and masturbation. So for that, I'll actually say it's untrue. Reason
okay.
being that there is no research, there's no paper, no write up anywhere that says that um, masturbation leads to
Causes.
causes infertility. Actually, so
Okay. So,
there's no scientific backup to it. If I'm to put
so
it
but
that
he's
way.
masturbating.
Okay.
Do you want to tackle the
Do you want to
masturbation?
tackle
Yes,
the
tackle
masturbation
both
or
of
you want
them.
us to answer his
Tackle both
question
of them. He
directly?
masturbates.
Okay.
Okay.
Okay. They're actually how do I put it? They're actually side effects, like
Okay.
downsides to it actually. And one of them is let me look at it from the scientific point of view. The downside that I am aware of to masturbation is it reduces sexual urges. Like
Okay.
and then first of all addiction. Let's start. That's the most common consequence.
Okay.
Addiction is something that somebody can go into and then consistently before you know you become comfortable in that zone and the person does it regularly. Then another thing can be the reduction in sexual urge, like what I talked about. So you hear stories of somebody having a partner, like they're probably now married, but they prefer to masturbate than have
Then
sex with
have
their partner.
sex. Yeah.
That's because they are now addicted and they now prefer masturbation. So these are the actual downsides that I'm aware
Okay.
of. Then the other one, of course, is the religious aspect to it.
Yes.
So but this person is not asking about that. But then if you are a Christian, you should know that I don't think there's any at all, any Christendom or any church at all that does support
Yes.
masturbation. But then in apart from that, you should be concerned about the health side
Yeah.
effects.
All
Yeah.
right.
Well, I don't know if he wants to stop or he wants to continue in the act. Well, I think that first of all, he shouldn't feel a certain way that he's
Okay.
doing that. There are a lot of people doing that like him. So we need to find out for him his habits.
Okay.
If he's reading stimulating articles, watching stimulating films,
Okay.
sexual films, and they can bring about the urge the urge to masturbate, especially when there's no woman there, and it has such a dynamic effect because it affects the sexuality of the person.
Okay.
So he kind of like becomes a maniac or a nymphomaniac
Okay.
in that sense, and it's something that he has to do with. He needs to examine himself,
Okay.
find out your day-to-day habits, your day-to-day. If you think so much about sexual activities, about sex and sexual media, you tend to have more tendency to masturbate. So I
Okay.
think you should tackle that first, then see a therapist if he wants to continue the process of stopping.
All right. So this is from a 25 years old lady. Is it normal for women to have a higher sex drive than men? Start with you.